Thank the gentleman for the time, and I congratulate the leadership of the House and the members of the New York delegation for bringing the 9/11 bill to the floor. I especially want to thank Ms. Maloney, Mr. Nadler, and Mr. King, who in a bipartisan fashion have put together this bill. This bill is long overdue. This bill simply says that we recognize the health needs of people who volunteered on that day, who volunteered to go for a long period of time, and who were told by the federal government that the air and the conditions in that area were safe. These folks now are suffering very difficult and complex illnesses that very few doctors and hospitals understand. Only certain specialized care facilities can manage their health problems. As I said before, the bill has a bipartisan approach, and that's something we don't always see around here, but we see it on this bill because of the importance and the need to do something and to do it now. It's been a long time since 9/11, and yet we spent a lot of money, as we have, as perhaps we should, on the war on terrorism, and that is correct. But there is another war, and it's a war to bring good health care to those who volunteered and those who were contracted to do this work. And so today I joined the New York delegation. I joined all members of Congress in a bipartisan fashion to say that this bill was long overdue and that we should approve this bill today without any stumbling blocks. Just simply come together as members of Congress, come together as two parties, come together as Americans to say thank you and to say the least we can do is to provide this health care for you in a very thankful way. And I yield back the balance of my time.
Gentleman yields back his time. Gentleman from Florida.
Speaker, it's my pleasure to yield 2 minutes to the distinguished Republican whip, Mr. Cantor.
Gentleman is recognized for 2 minutes.